The Newborn Assessment is one in a series of nursing assessment videos produced by the nursing faculty and media department of the University of Cincinnati Blue Ash College campus. Prior to beginning the assessment, review the maternal history for any parameters that may be responsible for abnormal findings in the newborn. The newborn physical and gestational assessment is conducted within hours of birth to determine transition to extrauterine life. Introduce yourself to the parents. Check the newborn ID band against the mothers. Explain the procedure to the parents. Perform hand hygiene and provide privacy. Put on a pair of disposable gloves if the newborn has not received its first bath. To complete the assessment, you will need the following equipment: a tape measure, alcohol wipes, pediatric stethoscope, bulb syringe, temperature probe, and pulse oximeter. Each clinician develops their own method to complete the head-to-toe assessment. Creating your own system will assure that all body systems are assessed with minimal disturbance to the newborn and the prevention of issues such as temperature control. Vital signs are best assessed when the newborn is in a quiet, alert state. Allowing the newborn to suck on your gloved finger may aid in calming the newborn during auscultation. A finger cot or pacifier may also be used to quiet the newborn. If excess mucus is present, use a bulb syringe to suction the nose and mouth. During the process of birth, the newborn skull sutures slide over each other to accommodate the fetal skull as it traverses the birth canal. This may result in swelling of the head, known as caput succedatum. A cephalohematoma may also form as a result of pressure on the fetal skull during the birth process. These are normal variations that should resolve in the days following birth. Examine the head for evidence of birth trauma. Feel the anterior fontanelle formed by the frontal bone and two parietal bones. It is diamond-shaped and should not be sunken or bulging. Follow the center sagittal suture to the posterior fontanelle, which is formed by the two parietal bones and the occipital bone. The newborn's head and chest circumference is obtained using a tape measure. These are important measurements that are repeated throughout childhood to determine growth and development. The length or height is obtained at birth and is obtained thereafter during routine pediatric visits. Taking the tape measure, place the number 1 above the eyebrow line in the center of the frontal bone. Wrap the tape measure around the head and record the number. The chest circumference is obtained by placing the tape measure around the body at the nipple line. Next, look at the newborn face. The outer canthus of the eyes should be at the level of the top of the earlobes. Check the patency of the nares by placing a finger over one nares at a time and confirm the newborn is breathing without evidence of nasal flaring or nasal obstruction. Place a finger in the newborn's mouth. Feel the hard palate for any separations or holes. Feel the gums for teeth and visualize the frenulum for position. Let the newborn suck on your finger briefly to check the sucking reflex. Move down to the clavicles to check for crepitus. This is an indication of birth trauma and damage to the clavicles. An abnormal Moro reflex may also indicate damage to the clavicles. Using a pediatric stethoscope, listen to the heart and lung fields. During the cardiac and respiratory assessment, look at the chest. Are respirations equal? Are the nipples aligned? Is the color of the newborn consistent from head to toe? Is there symmetry in the rise and fall of the chest during respiration? Count the respiratory rate. This can be somewhat difficult as newborn respirations are irregular, which is a normal variation. Observe for retractions, nasal flaring, malformations of the nasal cavity, abnormal pulsations, and a peristernal heave. During the heart examination, the care provider should evaluate the rate, rhythm, presence of murmurs, gallops, or clicks using the stethoscope. Murmurs are a normal variation during the first 24 to 48 hours following birth. Thereafter, no murmurs should be heard when auscultating the chest. However, if present, the pediatrician should be notified for further evaluation. Check femoral pulses and compare them with the brachial pulses. Inspect the abdomen visually first. Move the stethoscope down to the abdomen and listen to bowel sounds. Bowel sounds may be heard on either side of the abdomen. Meconium stool and urination should be passed by the newborn within the first 24 hours of life. When listening for bowel sounds, you are listening for fine crackles or the complete absence of bowel sounds. The absence of bowel sounds within the first 24 hours of life should be reported to the healthcare provider. While assessing the abdomen, look at the umbilical cord. The umbilical cord stump should be dry, and there should be no evidence of bleeding from the site where the clamp is placed. The skin is the largest organ of the newborn's body. Many normal discolorations and papules may be evident at birth and disappear within the first weeks of life. Others may linger for months or be permanent. The healthcare provider should examine for digits, fingers and toes, number and any abnormalities, look at the arms and legs, examine for range of motion, tone, and asymmetry. Again, the clavicles are examined to check for evidence of fractures. And then looking for some of the normal variations that can occur within those first days following birth. The presence of jaundice during the first 24 hours is considered abnormal and should be reported to the healthcare provider. Mongolian spots should be documented to assure that the pediatrician in the future will be able to determine if they are fading or are staying permanent. Other skin lesions to identify and document are milia, stork bites, and erythema toxicum neonatorum. The neurological exam is completed by eliciting reactions to certain stimulations. I usually tell the parents that these are baby tricks. The moral or startle reflex, Babinski, rooting, and filling along the spine for the possibility of a meningocele is all part of the neurological exam. To elicit the moral reflex, place your forefingers in the baby's hands, extend the arms out to the side, and then quickly release. The infant's arms should fan out and then pull close into the body. The rooting reflex is elicited by simply stroking the cheek of the newborn. When stroked, the infant should turn their face towards the stroke. The Babinski response is elicited by running a finger down the soles of the newborn's feet. The toes should fan out, then curl downward. Now turn the newborn over to the side and feel the spine from the base of the neck to the top of the gluteus maximus. If a dimple is noted at the base of the spine, spread it open with your fingers to document the skin is closed at the bottom. Any opening is indicative of spina bifida or a meningocele. The musculoskeletal exam includes checking for congenital dislocation of the hips. The ortolani exam should only be conducted by an experienced clinician. For students, you can simply turn the newborn over onto its belly and extend the legs and look for skin folds in the thighs. The ortolani exam is conducted by the examiner placing their fingertips over the hip sockets of the newborn and rotating the hips back towards the head and out to the side. The presence of a click when conducting this procedure is indicative of a dislocation or relocation of the hip. Clicks are typically common and benign due to an estrogenic effect from the mother. The other procedure for checking for hip dislocation is called the Barlow exam. Essentially, the newborn is laid on its stomach, the legs are hyperextended, and the practitioner looks for additional skin folds on the back of the thighs. From here, it is easy to access the genitals for examination. In boys, you want to check for descended testicles. Again, this may be a normal variation if the testicles have not descended, but it is not considered abnormal. For girls, the labia and breast tissue may be enlarged due to exposure to maternal hormones, and again, this is considered within normal. The Ballard Gestational Age Assessment should be completed within 4 hours of birth. Please refer to the Ballard Assessment videos on YouTube for a detailed explanation of completing this portion of the exam. Following the examination, put a clean diaper on the newborn and place the baby skin to skin on the mother's chest for approximately 20 minutes. This will allow the newborn to readjust following the physical examination and provide for a sense of security. To conclude the assessment, wash your hands and provide privacy for the family. Please refer to your textbook and clinical instructor for additional information regarding the assessment of the newborn.